If your child has all of a sudden become really finicky with food, isn't eating well, maybe has some odd behaviors that are unexplained but definitely there, this episode is for you. Today I have Shannon Leatherman on the show. She's a pediatric dietitian specializing in PANS and PANDAS. Not the animal. This is a neurological condition and an autoimmune condition that can spark extremely seriously picky eating, along with a lot of other symptoms that can impede your child's health and create a stressful dynamic around food and eating. She's here today to explain to us what PANS and PANDAS are and how to recognize some of the symptoms and how nutrition plays a role in treating this condition. So, you're going to meet Shannon and you're going to learn all about PANS and PANDAS. Even if you've never heard about it before, you will have your eyes opened, as did I. Here's Shannon. Hi, Shannon. Welcome to the Nourished Child podcast. It's so great to have you on the show today. I'm so pleased you could be here, and we've been trying to get this off and going for a couple of months. The summertime is busy, but welcome. I'm glad you're here.
Thank you. Yes, thanks so much for having me. I'm honored and really excited to be here. And I know I've learned a lot from you over the years, from your books and your podcasts. So I'm grateful to be able to give back a little bit today.
Well, I'm happy you're here because you're going to be talking about a topic I know very little about and have had virtually no experience with, which is PANS and PANDAS. But before we dive into this topic, tell us a little bit about yourself and the work that you're doing.
Yeah, so I became a dietitian in 2008, right at the start of a job recession. So my goal was always to work in outpatient education with diabetes, but I ended up landing my first job in an outpatient pediatric specialty center instead. But in hindsight, it was really meant to be. I've always loved working with kids. And so while at this specialty center, interestingly enough, back in 2011, that was the first time I ever heard of PANDAS. I had one diagnosed patient. We didn't really do anything for them specifically, but that's the first time I heard about it. But then I worked there for a few years, and then I started a family and eventually had 4 kids. And partway through there, I slowed down my work a bit, and eventually I took a few years completely off to stay home with my kids. Mm-hmm. I remember being really uncertain of how that would impact my career, but in hindsight, I feel like I got more hands-on learning with my own kids than I ever had in the field. So it was well worth it. No regrets. But right now I work part-time for a telehealth company. And I also have my own private practice where I do some one-on-one client work, both in person and virtual. I do some blogging and writing, and have been experimenting lately with some cooking classes and cooking camps. Mm-hmm. And I guess some specialties I have are specifically pediatrics. I also do maternal and family nutrition, and my subspecialties would be like picky eating and disordered eating, which are going to tie in with our topic today.
Yeah. And speaking of our topic, PANS and PANDAS, that is how I found you, because you wrote an article about this topic for today's dietitian.
Yes.
So you must be doing a little freelance writing as well.
Yes. Yeah, that was actually sort of on a whim. I'm not usually very impulsive. And actually that was one of my first experiences with freelance writing, but it was sort of like the mama bear in me rose up that day. It was actually on PANS and PANDAS Awareness Day last year. And I said, you know what? I'm not going to wallow in pity with what we're going through. I'm going to do something about it. So I wrote a query to today's dietitian and got accepted, and it was a fun experience.
That's awesome. So let's talk about what PANS and PANDAS is. Like, it's an acronym. So, what does it stand for? And describe what it is in simple terms for us.
Yeah, for sure. So they're both acronyms. So PANDAS, I'm going to start with. It stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. That's a mouthful. That one came around in 1998. And then in 2010, PANS followed. It's Pediatric Acute Onset Neuropsychiatric Syndrome. And actually, PANS is more the broader term. It encompasses pandas, but pandas usually accounts for about 3/4 of all PANS cases.
Okay.
And sometimes it goes by some other names too. So I personally like these better because they sort of emphasize the severity of it. It could be called basal ganglia encephalitis or autoimmune encephalitis. I think they describe it a little bit better.
Mm-hmm.
Um, it it is so the D in pandas is a disorder versus the S in PANS, which is a syndrome. So when you have a disorder, it just means that you have a known infectious trigger. So in the case of pandas, we have a known trigger of strep A.
Mm-hmm.
In the case of PANS, we still have like this cluster of symptoms, which is similar, but the trigger is different. It's usually an unknown trigger, or it might just be a different trigger, like a different bacteria, a different virus, or an environmental toxin. And I would say, as far as in simple terms, most parents are going to describe this like a light switch went off. Like one day you had this happy, healthy child. The next day your child woke up a completely different person. Though some cases might be a little bit more gradual. Even in our story, my son's case was a little bit more gradual. Another way it's often described is like your child's brain is on fire.
Mm.
And so um, they are both considered a clinical diagnosis of exclusion. So, clinical diagnosis means that it doesn't require like an actual lab test to
Mm-hmm.
prove that they have this. And then exclusion means that other similar disorders have to be ruled out first. So it makes these a little bit tricky to diagnose sometimes.
Mm-hmm.
They're both known for being like an abrupt onset of OCD. And then they can both also have an onset of tics, like TICS, different movements or noises that a kid might make. And then in the case of PANS, it can also have a severe eating restriction as part of the diagnosis.
Mm-hmm.
And then another key that sort of, this is really what sets these apart from some other disorders that are similar, is this secondary cluster of symptoms. And for PANS specifically, they have to have two or more of these, but it could include things like anxiety, aggression, mood or behavior changes, oppositional behavior, intrusive thoughts, separation anxiety, school refusal, uh, change in school performance like math and handwriting, sleep disturbances, bedwetting, even changes in motor skills like riding a bike and skin picking. So when I think of some like major red flags, if you have a kid who all of a sudden has this extreme school anxiety, or all of a sudden they have regressive bedwetting or regressive accidents in the daytime, or kids that have a really young eating disorder. Maybe you have a 10-year-old girl who's not worried about her body and she's all of a sudden having eating disorder symptoms.
Mm-hmm.
And some other really extreme ones, like kids that are throwing desks in their classroom or they're jumping out of moving cars. It sounds crazy, but these are definitely some red flags. Like I will have some parents tell me some crazy stories. I'm like, okay, the alarm bells are going off.
Mm-hmm.
And then a couple last things to toss in here too. It's episodic. That means it comes and goes.
Okay.
And like I said earlier, PANDAS with the S requires confirmation of strep infection. That is one of the requirements. And again, PANS is more, it doesn't require these, but it's more often triggered by some other like viral or bacterial or environmental causes.
So, like for PANS, what other types of environmental causes? I think before we
Yeah.
started the show, we talked about Lyme disease.
Yeah,
Are
for
there
sure.
other things?
Yeah, so some of the top ones that show up in PANS, one would be Mycoplasma pneumonia, which is often the bacteria in walking pneumonia.
Mm-hmm.
Um, so I'll say Lyme, but also just tick-borne illnesses in general. So there's a lot that you don't normally hear of. There's ones called Bartonella, one called Babesia, And then you have Borrelia, which is the standard Lyme. And then Epstein-Barr, which is the virus that causes mono. And then another like environmental one would be mold exposure. So
Mm.
sometimes you'll have families who maybe moved into a new house, or they had an unknown leak, or they were on vacation in a moldy cabin. And, sometimes some type of a mold exposure will set off symptoms too.
Wow. I
Yeah.
mean, there's just so many triggers,
It,
right? And my
yeah.
brain is sort of
Yeah.
wondering how does, well, I actually, how do you differentiate that from like a child with extreme picky eating or
Yeah.
ARFID, for example?
Yeah. So that's a good question. And again, I think that's where some good screening questions come in.
Hmm.
So usually with my whenever I have a suspect, now again, because one of the diagnostic criteria for PANS is an extreme eating restriction.
Hmm.
Since I've dove into this research and gone down this rabbit hole, I do tend to screen most of my picky eaters and eating disorders, even just like mildly. I might not ask a lot of screening questions, but at least a few. And oftentimes they're offering this information and they don't even realize it. I can't tell you how many. I've had like two or three in the past year where I'm working with a younger child with the eating disorder, maybe like a pretty young teenager, girl or boy alike. And the parents will just toss out there, oh, yeah, they had a lot of strep infections. And so I think sort of some of those screening questions are, well, when did you first notice symptoms?
Hmm.
Were there any infections or illnesses around this time? And then I think the big thing, sometimes I'll even pull up this chart. There's a great website called aspire.care, and they're sort of like the end all be all of all things pans and pandas. They're the resource of all resources. And they have this pie chart on their website that has, pretty much all this cluster of symptoms.
Hmm.
And so sometimes I'll pull the chart up and I'll show the parents and I'll say, hey, just, I can't give you a diagnosis, but look through this chart. And sometimes they'll look there and it's like their kid has maybe 3/4 of the symptoms on that chart. So I think
Wow.
a big differentiating thing is just that cluster.
Hmm.
And I think that's a lot of times what gets missed. The first thing that might have been picked up was OCD. So the child's diagnosed with OCD, where we sort of forgot to pick up these other symptoms along the way.
Yeah. So PANDAS is pediatric acute neuro, or is the
Yeah.
A
The
acute?
A, so the A for pandas is autoimmune.
Autoimmune,
Um,
autoimmune.
but and
Yes.
for pans is acute. I think the A is important in both of them.
Okay. So let's
Yeah.
talk about that. What is,
Yeah.
because autoimmune is, something that you hear a lot of adults talking about that they
Yeah.
discover later in life. Um,
Hmm. Yeah. So in this case, really in any autoimmune disorder, it's a form of the body attacking itself. So it's basically immune dysfunction. And any autoimmune condition tends to be pretty inflammatory. On the inside, we can't really see the inflammation, but the symptoms are the way that we're feeling it.
mhm,
And so in this case, this symptom is immune mediated, so it's not infectious. We say that it's triggered by strep and triggered by these viral and bacterial illnesses, etc. But at the end of the day, it's immune. It's an autoimmune illness,
mhm.
and so the infections are not causing it, but they're just causing the symptoms.
The
And along
inflammatory
those lines,
response.
too, there's a strong link of family history with autoimmune and strep related
Mhm,
illnesses,
mhm.
up to 70%. I know I personally have an autoimmune disease. My husband, as we've dug through this story, he had a strep related autoimmune illness when he was in college, and his resolved. It wasn't not this same illness, but so there's definitely family history that can play a role.
Yeah. And do you find, Shannon, that children present with lots of different symptoms? Like you shared that your son went through this, and then I know you've had a lot of experience with other families with children. Do you see similar sort of common symptoms amongst all the kids, or are they really kind of all over the place?
Yeah, that's a good question. They can be all over the place, and again, then we have these elements of flares, which yeah, I can talk more about that later. But
Mm-hmm.
so sometimes you might start with one symptom, like in my son's case, his started with tics. Again, the TICS, where he was just moving his head weirdly, making some weird noises,
Mm-hmm.
and then those would fizzle out, and then all of a sudden he'd have some mood changes, and so I know when I look at the list, that pie chart I was talking about, I see we've had most of the symptoms on the list, but they're not always at the same time.
Mm-hmm.
And then again, sometimes you feel like you're getting lucky, some go away, and then something else pops up. So again, as part of the diagnostic criteria is OCD. So definitely OCD pops up. And again, it's not always your typical OCD. That you might think of. It's not always like obsessive hand washing. It can be other things, just like repetitive behaviors. I mean, something my son does is he can't get sports things out of his head. He will ask us again and again and again about sports scores and checking the sports scores and when's the game on. And I know that can be common in boys in general or some kids, but I mean, this is like an obsessive form of that. So
Mm-hmm.
OCD definitely can be a common one.
So
Yeah, yeah.
when you say OCD, that stirs up sort of more of a mental health picture for me.
Hmm. Yeah.
But then you say tics, which really kind of conveys neurological
Hmm.
disorder. So is it one or the other, or what is PANS and PANDAS considered, or is this something completely different?
Yeah, no, that's also a great question. So it's usually referred to as a neuroimmune disorder. So
Mm-hmm.
it's a little different than neurodevelopmental, which would be like, autism, ADHD. It's a little different than neurological, which would be like your tics or seizures, and it's different than psychiatric, which might be, OCD or
Anxiety.
anxiety.
Mm-hmm.
So I basically say it's an autoimmune disorder, but it has neurological and psychiatric symptoms. And because of that, it can easily be misdiagnosed.
Mm-hmm.
And even just like when you're thinking of the different treating physicians, we have the whole gamut. We have sometimes a pediatrician, sometimes a neurologist, a psychiatrist, an immunologist, a ear, nose, and throat, integrative and functional doctors, and naturopathic doctors. Like there's not, unfortunately, it doesn't it doesn't fall under one specialty. It's sort of like hit or miss wherever, whoever is in your area in the country that happens to treat this, is who treats it. And
Yeah.
also, along the lines with what you just asked in the question before, I would say a few main differences that sort of set this apart. The one being there's this direct impact of inflammation on a part of the brain called the basal ganglia. And that's this thing we probably most of us haven't heard of. It's deep in the inner part of the brain. It's about the size of a gumball, and it's a group of cells. And there's also a lot of immune regulating cells within the basal ganglia. And it's sort of like a circuit board part of the brain. And
Mm-hmm.
so it's primarily responsible for movements and motor control, also mood regulation, behaviors, emotions, decision making, including risk taking, which is why some kids will do these crazy things like jumping out of cars. But it also, because it's sort of like a circuit board, it directly communicates with the prefrontal cortex of the brain, which is the part that a lot of kids with ADHD have trouble with. And
Mm-hmm.
so it can still have a lot of overlap with other similar illnesses. So again, it can sometimes there have been cases where kids have been diagnosed with autism, and then when they're treated for PANS and PANDAS, their autism diagnosis has gone away. So it's a very interesting. And then again, a few other things that set it apart, like we already said, it's triggered by an actual infectious or environmental agent. Something else interesting that shows up a lot is it can often come across, or it can often be like treatment resistant to traditional neurological or psych meds. So somebody might have been misdiagnosed with anxiety, or they might even have a diagnosis of PANS or PANDAS, but they're struggling with anxiety. They'll go on a medication for it, and actually makes things worse.
Mm-hmm.
So because again, you're not treating the issue.
Mm-hmm.
And again, the last thing I would say that sets it apart a little bit from some of these other ones is this ebb and flow. We call it a sawtooth pattern because it's sort of like the teeth on a saw, where it does have this pattern of flares and remission, or at least partial remission. I know, like in our case, we sort of have a baseline that's not perfect, but it's better. But then when we have flares, like, it's a flare. It can get a little rough.
So, how common is this in children today? And, it sounds like it's such a complex constellation of symptoms that it's easily misdiagnosed, which I think you said, but like, how do you find help for this? How common is it? And who's,
Yeah.
how,
Yeah.
how easy is it to actually find
Yeah.
out that this is what these children have?
Yeah. So, again, part of as far as how common it is, the estimates are still a little hard to come by just due to the lack of research. Again, these are both younger diagnoses when it comes to the medical world. So they've only been around for like 15 to 25 years.
Mm-hmm.
But the estimates are around like 1 in 200. And that's, again, completely a rough estimate. And there's a lot of controversy around it. Unfortunately, there really shouldn't be. I think any doctor who treats it doesn't understand the controversy. But I think, again, there's also a lot of these misdiagnoses or overlapping ones. So again, you might have a kid who was first diagnosed with ARFID, which is avoidant restrictive food intake disorder, or like an atypical eating disorder, or OCD, or Tourette's.
Mm-hmm.
And so, and like I said, sometimes it's a complete misdiagnosis. Other times it's just an overlapping diagnosis. And so I think that's part of, part of what's going on. And then I do think there has been, a little bit of an uptick in cases too, which is why parents and practitioners are taking notice. And some of the challenges too with getting a diagnosis, I think one of the biggest ones is in the medical and insurance driven healthcare world that we live in. There's no current diagnosis billing code specifically for PANS or PANDAS. So the doctors have to get creative, and it's not always covered. So it can be tricky. And then, like I said, sometimes these other disorders have to be ruled out first. Sometimes that's not happening. And again, sometimes even parents have difficulty recognizing OCD in kids. You might know something's off, but again, your kid's not washing their hands obsessively. So you really like, I don't know, is this normal?
It could be
And
like pulling hair, right?
yeah,
Or pulling your
yep,
eyebrows,
yep.
picking your
And
nails.
and
Yeah.
another one that shows up a lot, specifically in these kids, is intrusive thoughts, where it's like
Mm.
these dark, they're sort of dark, like worried about dying, and they just can't get these thoughts out of their head.
Mm.
So a lot of, a lot of that.
Does it
And
affect,
then,
Shannon, does it affect one gender more than the other? Or is it,
yeah,
it does? Okay.
yeah, it does. And that's, again, another good question. Yeah. So boys are 2 to 5 times more likely than girls to
Mm-hmm.
experience pandas. And that's similar to some other neurodevelopmental disorders like autism.
Mm-hmm.
I don't think I mentioned this yet, but PANDAS does have an age limit, which I'd say the average age tends to fall in the 3 to 13 age. So PANS does not have an age limit, even though it says pediatric in the acronym. You can have cases of adult onset. And if there is a post-puberty strep infection that induces this, it's going to fall under the PANS category and not the PANDAS.
Mm.
Um, yeah.
Interesting. So just, I think the listeners are probably like, okay, wrapping my head around this, but can we walk through just like a case scenario? Probably is not, I was going to say a typical case, but it doesn't
Yeah.
sound like there's like a lot of typical cases. But can you give us an example of sort of the timeline of how this might show up and what those symptoms might be that prompts a parent to go to the doctor, and then then we'll go from there and talk about the illness itself and whether it's chronic or, acute, and the flares and all that stuff. But paint sort of
Yeah.
the case scenario, a typical or a
Yeah.
sample case scenario for us.
Yeah. So, I mean, I suppose I can even share a little bit of our story briefly. I don't know if that would be all right.
That's fine.
So in our case, my son was 4, and shortly after his birthday, he developed some weird symptoms, and this was like mostly jerking his head up and down or off to the side. And so it was pretty subtle, and we sort of tried to ignore it. But then, like I said earlier, over the summer, then it progressed, and it switched to sort of this mood problems of anger, aggression. He was like our chill kid who could have brushed anything off, happy go lucky. And all of a sudden he's getting angry and punching and throwing. And so then we had a lengthy bout of COVID at the end of that summer. And his just lasted far longer than any of the rest of us. And so he was 4 at the time. At one point, he was screaming at me in the car to take him to the doctor. So I took him to the doctor, and everything checked out fine, but she just wanted to cover her bases, and she decided to do a strep test. And it was negative initially, but then a few days later, she called and said it was positive. And so I sort of reluctantly gave the antibiotics because I was like, he doesn't even have strep symptoms. But the weird thing was that the antibiotics did nothing for his COVID symptoms, but all of a sudden we noticed, no more head ticking and no more, all of a sudden his mood shifted and his aggression slowed down. And so, again, that's not everyone's case. I would say our case was maybe like part of the tricky part with our case and with some others was that it was somewhat of an acute onset, but it was subtle. So it was hard to pick up, like I said, we were sort of, we weren't really paying attention to every head movement. We were trying to ignore it. So oftentimes it will, for strep, it often will start within 1 to 3 days of an infection, but sometimes it can be up to 30 days post-infection. And then again, something that makes diagnoses difficult for some people is when there could possibly be, especially an underlying tick-borne illness or Lyme, sometimes, or if it's like an environmental thing, like you're living in a chronic environment of mold or something, the symptoms could be a little bit more gradual and hard to come by. But again, then for our story specifically, we had quite a long remission after that. We had about 1.5 years where he had minimal to no symptoms. But then it came back with a vengeance in 2023. And again, so just, for a description, if someone's listening and their child has this, that, this might sound like their story, but if this is new to you, my son was in first grade, 6 years old, and he stood at the top of our steps and he looked at me and he said, "What if I just fell down these steps and died?" And, my mom heart just sort of stopped, and I'm like, something's not right here. And so, and then fast forward a few months to Christmas, again, 6-year-old at Christmas, and he woke up to the pile of presents under the tree, and all he could ask about the entire day was about the Eagles football game that was going to be on later that day. And he would open a present and he would just be mad, and he'd say, "Why did you get me this?" And so those were our breaking points. Again, everyone probably has different breaking points in their story, but again, part of our story and part of so many people's stories is that it can take a long time to get a diagnosis. I forget the statistics on this one, but I know for us, it took 3 years. There's a statistic about, how many years and how many doctors you go through before getting a diagnosis, but it can take a while.
How did you feel after you got the diagnosis?
Yeah, it was a relief. I mean, it's also a little bit sad, you never want your kid to have something, especially that could be chronic, but it's also just like this reassuring, like, okay, I'm not crazy, we're not crazy. And then just to finally be able to get help, because, in our case, I did have to dig. I think maybe you'd ask this for a different question, but yeah, like, where do you go to find help? I say one of the biggest top 2 resources of where to find help. There is a wonderful website called the PANDAS Physician Network. And this is great if you're a practitioner listening in and not that familiar. And some, if you want to learn or you want to pinch hit, they actually have some really good flow charts on there for practitioners.
Mm-hmm.
But they have a directory of providers who are at least PANS and PANDAS informed.
Mm-hmm.
And then another great resource, which we have also found help through, is just support groups. And in my case, there's a lot of great Facebook groups out there. There's like huge nationwide ones. And there's also local ones. So we've had good luck with finding support.
Yeah.
In both.
Hey guys, I just want to take a quick break and encourage you to subscribe to this show. And if you can, share it with just one friend. Whether you do that on YouTube or you do it on your podcast app, I would greatly appreciate it. And I also want to invite you to join my newsletter called The Munch. MUNCH. You can simply go to thenourished.com/munch and sign up. Also, don't forget, thenourished.com has tons of information for you about nutrition for kids and feeding them, and I hope you will find it a useful resource. Okay, let's get back to the show. Shannon, do they fully recover from PANDAS or PANS? Is it something that they live with for the rest of their lives, managing the sort of acute flare-ups? What is...
So I don't have statistics on this one. And honestly, I don't know that there are. But I would say that the ultimate key is early diagnosis and proper treatment. So if you can identify the trigger early on so it can be treated, that's huge. And then also because it's autoimmune, coming alongside and supporting the immune system to help it fight off future infections. Mm-hmm. And so there are absolutely stories of families whose children fully recover, or even if you call it going into remission, there are absolutely stories out there. The key for that, again, is finding a good doctor who's going to listen to your story and who's either knowledgeable or willing to learn. Because a lot of doctors, they'll just decide to go out on a limb, take one case and give it a try, and then they're hooked because they see the improvement. But I know I also have had to search for these stories, sometimes even for myself and for our family, just because a lot of times in the support groups, you're hearing more the painful stories, the people that are looking for help. And every once in a while, somebody will share just a positive story of how their kid was healed. And I know there's some good books out there too. So again, sadly, I don't have statistics, but again, the key out there is early intervention, early treatment. I mean, I was listening to a doctor talk recently, and he was a pediatrician who treats mild early cases, and he has such good outcomes. I think he was actually up in your area too, but he treats them with 1 month of antibiotics, and sometimes he has to put them on some like over the counter, like Aleve or ibuprofen, and they're healed. Sometimes it takes a year for mild cases too, but again, in our story and a lot of other people's, they're complicated. There might be a delayed diagnosis. There might be a few factors. I know that's part of our story, and that's part of a lot of other people's stories too. And I would say the number one thing that keeps people from healing, aside from that quick diagnosis, is finances. I like to joke that if I won the lottery, my son would be healed already. It's very expensive, and that can definitely prevent optimal treatment. So there are some great resources out there too. There's an organization called the Look Foundation that provides some grants, and then there's one called Claimable that helps people get IVIG, which is a pretty pricey treatment for more extreme cases.
So let's talk about the treatment, because you mentioned ibuprofen, you mentioned antibiotics, you've mentioned IgG infusions, you mentioned diet. What is the treatment approach for PANS and PANDAS?
Yeah. So, from the medical standpoint, the standard starting place is if you actually do get a positive diagnosis, especially if PANDAS, when it was like the strep, you are supposed to do a 1 month trial of antibiotics. And then in some cases, doctors, depending, sometimes they'll use steroids if it's a little bit worse of a flare. And again, sometimes just like, on the medication topic, sometimes again, the anti-inflammatory, like again, the ibuprofen, and sometimes they'll even use Aleve in kids. So that's more the medical route. Again, for extreme cases, they will do some infusions, but they're expensive. But then there are definitely some nutrition and dietary things. And I know we found some good starting relief there. And that's an area I enjoy helping people work through too.
Yeah, so let's dive into that since this is a nutrition podcast.
Yeah, for sure.
What is the role of nutrition in pandas and pans, and what have you found in your own practice and with your own child has been really key to helping?
Yeah. So, and I'm just going to give a quick caveat before I say anything about diet and nutrition. I just want to speak to any parents or caregivers listening that are navigating PANS or PANDAS. You know very well that this is overwhelming. So please do not pile on the guilt or the fear. I always encourage people just to reframe and think like, what can we add rather than what do we need to take away, or what's one small change we can make rather than I'm doing this all wrong. This is really meant to educate and empower you. So I personally like to think of PANDAS nutrition in 3 categories. I talk about preventative, restorative, and therapeutic. And so preventative, it's not preventing the illness, but it can prevent the symptoms from getting worse and, even potentially prevent some symptoms from ever happening. And that I would say tends to be more focused on like anti-inflammatory foods and anti-inflammatory diet. And the goal there is really just to support the gut, to support the brain and the immune function. And so, like I said earlier, PANDAS is very inflammatory, like other autoimmune diseases. And that's sort of how the body protects itself. If you got a bug bite on your skin, it gets red and itchy, but that same kind of red and itchy is going on in our brain. We just can't see it, but it's showing up as these neurological and psychiatric symptoms. So we're thinking like, how can we get this to calm down? So again, poor diet isn't causing PANS and PANDAS, but it can definitely worsen it or create new symptoms. And then the opposite's true. Anti-inflammatory can help to reduce symptoms and calm down the inflammation. So, some anti-inflammatory foods tend to be, in very general sense, like more whole foods, more single ingredient foods. Fruits and veggies that are very colorful are going to have these powerful antioxidants. I like to pretend that they're like little soldiers that are fighting against the inflammation. And then certainly omega-3s, which are in fish and nuts and seeds, they're not only anti-inflammatory, but they're also very neuroprotective. And then there's also a lot of herbs and spices. I personally in my practice don't use a ton of these in the therapeutic sense, though you can. But even just using them more in your cooking, things like cinnamon and cocoa and turmeric and ginger, oregano, even stevia has actually been studied specifically with some of these tick-borne illnesses. And then on the flip side, sadly, a lot of foods that kids love, foods that are high in sugar and fat and the refined grains, those not only are going to be low in nutrients, but they can also worsen this inflammation. So, if you're tuning in and your child is not that picky of an eater, then this can be a little bit easier. Again, thinking about more of a preventative measure. So, trying to think of ways to rotate in more colorful fruits and veggies, maybe especially some orange and yellow ones like mango or cantaloupe or sweet potatoes. Maybe it's switching out, one processed snack for something that comes from the fridge. We have a little mantra in our house. We say fruit first or fridge first when they come home from school. So something like that. It could be including a little bit more fish. If you're not doing any fish, can we do fish once a month, even if it's tuna fish, or can we add in some nuts and seeds as trail mix or in oatmeal or something like that?
What do you do, Shannon, though, if you have a child with PANS or PANDAS and they're really picky?
Yes, that is.
And
is that common?
Is that a common symptom?
Yeah, a very common symptom, and it makes it complex. And again, this is where if you're tuning in, please don't pile on the guilt. It's so tricky. I would say this is a loaded topic. One thing I would say is just making sort of prioritizing, really. So I like to, when I'm helping them on my end, I actually go so far as to make a roadmap because they can be so complex.
Mhm.
And so my number one goal would be to prevent the pickiness from developing into malnutrition. So,
Mhm.
we want to make sure that they're at least getting, the calories to maintain or, restore their growth a little bit. So
Mhm.
I always tell parents, a nourished brain is going to respond better to diet expansion. So first we have to, stop any kind of malnutrition, and then we work on these other things. I also say a nourished brain is going to have reduced risk of any kind of disordered eating thoughts or behaviors. So again, in these cases, my number one priority is to help the families and help the kids maintain their growth. Um, Again, it could be from a calorie and protein standpoint. And, in these extreme cases, I'll say technically, I know you and I know technically kids could eat enough from or eat enough calories from like 5 foods if they were just eating chicken nuggets, macaroni, applesauce, goldfish, and milk. But we also know that pretty quickly this is going to lead to nutrient deficiencies. They're going to be
Mhm.
missing out on essential amino acids, essential fatty acids, vitamins, minerals, etc. And so that's not our end goal, but it's our first priority.
Mhm.
And then I would say our second priority is going to be to restore any nutrient deficiencies or prevent further ones. And so I like to mention that a kid can still be malnourished even if their weight and their growth is okay.
Mhm.
So, we're still focusing on things like, making sure they're getting enough and hopefully optimal protein, these anti-inflammatory fats like we talked about. But in this case, this is where we can really focus on adding in some nutrient supplements. It could be something like a shake, but also I really like to add in some good high quality vitamin and mineral supplements too.
Mhm.
I think the top nutrients that I see missing the most, and this is pretty common,
Mhm.
is protein.
Mhm.
And along with protein, iron and zinc are often found in those foods,
Mhm.
and magnesium. And
Yeah.
all of these nutrients, the deficiencies can worsen the symptoms, both for the brain and the immune supportive nutrients. So we're really going to work on getting those in through vitamins, through minerals, and
Magnesium's an interesting one.
yeah,
Why
yeah.
are they deficient in magnesium?
Yeah, so I'll say it's hard to test for this one. There is testing possible. It's not probably fully accurate. One of the things is I just go through their food recall, and
Mhm.
some of them are just eating so few like nuts and seeds, which are
Yeah.
some top sources of magnesium. And then I also go through some physical signs and symptoms, if there's any kind of constipation present or like muscle tension, sleep disturbances. So those would be more like validating. So if I'm seeing a diet that's low in magnesium food sources and a lot of physical signs and symptoms, again, sometimes those alarm bells are going off. Okay, this child would probably
Sure.
benefit from some type of
Mhm.
magnesium supplementation.
I just asked
Yeah.
because I feel
Yeah.
like magnesium's sort of the panacea for
Yeah.
sleep and
Right.
for
Right.
constipation, and it
Yeah.
is, and
Yeah.
I think it's an important connection to make for the audience that, it's a tough one to measure in a lab I mean, you can measure it in a lab test, but it's
Yeah.
the correlation between your diet and your blood values is not always strongly correlated, right? We're going to keep
Right,
that
exactly. Because
magnesium.
it's stored in different parts. It's stored in muscles and bones and
Yeah,
organs. So
yeah.
it's not
The
always showing up in the blood.
exactly,
Yeah.
exactly. And the body is going to prioritize that normal value in the blood as
Yeah.
long as it can. So,
Yeah. And then real quick, I'm just going to add here too. After those top two priorities, then I sort of have like priority number 3 and 4 would be sort of what parents sometimes are looking for right away, but we don't always do right away is this expanding the diet and sometimes improving the parent's feeding strategies.
Mhm.
And so this is, that's sort of the long haul. That's stuff that could be going on in the background while we're keeping those other things as the top priorities.
Mhm. Mhm. So to wrap this up, because this is a lot, and I feel
Yeah.
like we just have like hit the tip of the iceberg. There's probably so much more about
Yeah.
this, but when you're thinking about a piece of advice that you can give to parents who might be struggling with this, who might be wondering, gosh, is this something my child actually has, and we don't even know
Yeah.
it?
Yeah.
Um, what kind of what kind of advice can you offer parents in terms of getting a diagnosis or working through a diagnosis and the nutrition changes that come with it?
Yeah. Um, so let's see, let's start with getting a diagnosis. Again, if you heard anything today, and again, maybe alarm bells were going off, maybe you tune into this because your child is a little bit of a picky eater and you've liked the other episodes. Again, I would point you to, not for a self-diagnosis, but, I would point you to the website I mentioned, aspire.care,
Mhm.
aspire.care. And um, again, that has a lot of just, some easy, simple answers to some of these questions. And it can help you put some pieces together just to even see, like, is this worth looking into?
Mhm.
Um, and then again, getting a diagnosis, I'm going to say it can certainly be tricky. I find actually a lot of people jump into these support groups before their kid even has a diagnosis.
Mm.
And that's not something I did, but I think that might be helpful because sometimes they're just throwing out there, hey, my kid has this, and this. Do you think we should get evaluated? And then the parents chime in and offer their 2 cents. And a lot of times, most times it's very helpful.
Mhm.
Um, and again, though, if you're pretty confident or you really want to search, again, that's where that Pandas Physician Network has a directory. Or again, you can look within your state and see if there's again, maybe a Facebook support group. There's a lot of state-based ones that you can just put a question in there, ask around of who they might recommend. And keep me on track here. What was the second the second
Well,
question you
I
asked?
think just in terms of feeling hopeless around the dietary changes, because
Yeah,
as you
yeah,
mentioned, some of these children are quite picky. And
yes,
I mean,
yes.
perhaps one of the things that would resonate with parents, and tell me if this is true or not, but I imagine that the typical picky eating strategies may not work with these kids.
Yeah. And I'll say sometimes they do, for
Mhm.
sure. Like probably a lot of your past episodes, I'm sure you can pick out a lot of things. But the number one thing is if your child has a true diagnosis, they need to be treated because you're just going to keep spinning on a hamster wheel. And
Mhm.
even, I mean, I have someone I'm working with right now who hasn't gotten tested. It's harder because she's a little bit older um, but I have almost no doubt that she has some element of this, but the full healing, if whether it's for a food aversion or for an eating disorder, is not going to come if we don't treat this underlying infectious illness. So
Mhm.
that is definitely number one. And then, like I said earlier, as a parent, really work on taking off that guilty head. I know anytime nutrition comes up for any kind of illness, oh, it can just pile on that guilt. So, again, just I know we didn't talk a ton about nutrition here today, but put on the empowered hat. What can you do? My daughter was younger when the movie Frozen 2 came out, so I'm going to take the line from Anna, and she says, "Do the next right thing." So that's what I tell people. So pick one thing, and sometimes that's not even always easy. But you might ask, like, what does my child need most? Do they need preventative nutrition? Do they need restorative, which is going to be more like those supplements, or do they need therapeutic, which yeah, we didn't even get into that, but that's where you're using sort of the bioactive substances in food or diets to reduce symptoms. So you're sort of picking like what does my child need most, or what's the most difficult symptom to manage, or
Mhm.
what's the easiest thing to change right now.
Mhm. Mhm.
So an example I could give is if behaviors are the most challenging, Um, we might be exploring, are we getting enough protein at our meals so we're not having like blood sugar, hangry issues? Or again, we didn't get into this, but like, are there any ingredients in the foods that might be exacerbating some of these behaviors? If your child has a really low color diet, which is common again, your one change, your next right thing might be just adding in a high quality multivitamin,
Mm-hmm.
while we're working on trial, maybe some real easy trials of like a peeled apple or a banana based smoothie that's also a low color, but it's more nourishing.
Mm-hmm.
Um, and then on the flip side, if the OCD or the food aversion is so severe, your next right thing might just be finding a doctor, or finding a different doctor who's going to treat the underlying infection and the underlying immune dysfunction.
Yeah. Yeah. I hate to go back to the nutrition, but
Yeah.
we didn't cover the therapeutic nutrition. And when you started
Yeah.
talking about bioactive compounds,
Yeah.
I think we
Yeah.
need to explore that, just if you have an extra minute to just
Yeah,
really
for
explore that.
sure. For
What are
sure.
what are you, so therapeutic, so you've gone prevention nutrition, you said restorative, so we're restoring maybe a child who's underweight or nutrient deficient, or and then
Yeah. Yeah.
therapeutic. Take us into
Yeah,
therapeutic.
yeah. So therapeutic is quite loaded, and I'll summarize it. And again, we can get into the weeds with this one, but I would say therapeutic is either adding or removing bioactive substances in food. And the goal is to improve symptoms and really to relieve any kind of extra burden on the body that the body's just not tolerating. So, and I always tell people, first of all, this is never like my first line unless a parent's like begging for this or asking for information. This is something that, we might explore down the road. And I tell parents, it's not that these foods are bad or bad for all people, but sometimes they just might not be right for your child right now.
Mhm.
And it's also very symptom dependent, situation dependent. I mean, there's definitely research out there. And I'd say it's building. There's not a lot specifically in the PANS and PANDAS world. I know there's one parent survey out there that did show some improvements with like a gluten-free, dairy-free, anti-inflammatory diet. There's a lot of case reports from PANS and PANDAS practitioners, but I would say a lot of the research comes more in studies from the autism and ADHD world,
Mhm.
and also for other autoimmune disorders. So like celiac and thyroid, we're seeing some of these benefits.
Mhm.
So there's a number of studies. There's actually an interesting one that came out just a few years ago. It's a survey study, so it's a little different. It's not like a randomized control trial, but it was 818 people, and they were put on one of 13 different therapeutic diets. And the top four diets that came out of the study were gluten-free, dairy-free, a healthy, low sugar, and also this fine gold, which is like no artificial flavors, colors, additives. And again,
Mhm.
these have been around for years. They show up in a lot of books around these illnesses.
Mhm.
But the top symptom improvements of all of these four diets were improvement in attention, hyperactivity, mood, aggression, gut health, OCD, sleep, and tics. And you can see from that list, a bunch of those are symptoms that
Mhm.
are in the PANS and PANDAS illness. So, they're worth exploring. I say more often I would start people. I sort of say there's a really low risk in trying to do a diet that's a little lower in sugar and a little, not necessarily removing all processed foods, but just being label detectives.
Mhm.
I mean, you can find a lot by looking at labels. Again,
Mhm.
I'm not here to bash food products, but again, like I said earlier, it's not that the foods are bad, but they just might not be right for your
Mhm.
child right now.
Right.
And so there are legitimate cases of food sensitivities where there are certain additives and chemicals that kids really are responding to, and they're not having like an allergy. It's not like their lips are swelling, but they're instead have, again, you can think of it, like I said, with that mosquito bite. It's sort of that, that brain itch is going on, and it's showing up as behavior outbursts. And so, again, that's not a cause of PANS and PANDAS, but if we are already having behavior problems, we definitely want to get rid of what we can if it's food related.
Mm-hmm. Mm-hmm. That's
Again,
great.
I could go on further. I don't know what else.
No,
I don't know how much time you have.
I think that's good for today, but perhaps we have you
Sure.
come back again and maybe explore some different elements of Pans and Pandas, because it sounds like it's very complex. And I think, just again, full disclosure, I've never really worked with a child with Pans and Pandas, but I am now thinking and suspicious of
Yeah.
whether I have, and just nobody, because I've certainly worked with some very restrictive eaters with OCD and behavioral, oppositional type of behaviors. So my brain is sort of like, huh.
Yeah. Yeah.
Um, but I would also, well, I just really appreciate all the information that you've shared here today. It's a complex topic. I think that for parents out there who are suspecting or curious or nervous about, you've shared some great links and website resources, which I'll put in the show notes so you as a listener can go and explore more. For the dietitians and pediatricians out there, I hope this builds awareness on some level. And I know also, Shannon, you shared that the Pans and Pandas Awareness Day is this early October, correct?
Yeah.
Or is
It's
it the
coming
month
up.
of October?
Yeah. I think it's one day. It's, I believe, 2 weeks from now, October 9th.
Okay, so this will be
Yes.
airing a week before that Awareness Day. So, folks, if you see stuff on your social media about this podcast episode and awareness around Pans and Pandas, please share it. And then also, if you see other stuff on Pans and Pandas, share it. Let's build the awareness about this to help other parents and children heal from this, get supported from this condition. And then last, I would say, Shannon, where can people find you if they want to connect more with you, if they want to seek out your services or the resources that you have available?
Sure. So I have a website. It's Food to Table RD. So FOODTOTABLERD.com. And I have a Facebook and Pinterest group, Food to Table Nutrition. And also on my website, I do have different blog articles that tend to focus on picky eating and kid-friendly recipes.
Mm-hmm.
And if you're located near Southeastern PA and you did need any services, whether for Pans and Pandas or just for pediatric nutrition, I do offer both in-person and virtual appointments, and I also accept most insurances. And I know we didn't get into this today, but if you are looking for some resources, I do have a free downloadable Food Explorer worksheet, which I can give the link for the show notes to. It just has some fun little extras. We have some emoji taste tests, cards, and some positive food affirmations, some fun things that can be helpful as you navigate this journey.
Wonderful. Wonderful. Shannon, thank you so much. It was great to have you on the show, and appreciate all the work that you're doing for Pans and Pandas
Yeah.
families.
Yes. Well, thank you so much for having me. It has been a pleasure.
I hope you enjoyed the show today, folks. I know it was a lot to take in. Pans and Pandas is increasingly common amongst young children. It is oftentimes related to a virus or something like strep. If you are worried about your child, you're seeing symptoms in children in your practice, please head to the show notes for this episode, where you will find some of the links that Shannon shared in the show, including resources and a doctor's network where you can have your child evaluated or look further into the symptoms that they are experiencing. As always, I'm so happy that you listen to this show. If you have a chance to rate it, review it on your podcast app, that would be amazing. And as always, make sure you give that child in your life a loving squeeze today. Bye for now.
Thanks for listening to the Nourished Child Podcast, where the #1 goal is to help you grow a nourished child inside and out.